Today, we're going to talk about techniques that will assist you in the ongoing dental care of your clients. Some clients are uncooperative and resist dental care or toothbrushing. It isn't because they don't like you or because they don't like having their teeth brushed. These are reflexive responses that are often misinterpreted as personal aggression. A client's body does not always know how to cooperate. The physical ways a client may react to dental care include pulling away from the toothbrush, sucking in their cheeks, biting on their toothbrush, and piercing their lips. Many clients may suffer from oral hypersensitivity, which means they are orally sensitive to touch, textures, or tastes in their mouth. The sensation for them is similar how one might react to the sound of nails on a chalkboard. One of the best things you can do before you begin dental care for your client is to make sure they are positioned properly. Clients respond better to dental care in a position they feel safest in. The safest position is standing or sitting upright at 90 degrees. If a client must be seated in a wheelchair, be sure it is positioned upright at 90 degrees. Reclining can cause aspiration and gagging due to saliva going down the wrong pipe and into their airway. It may feel threatening to a client to have someone leaning over them when they are lying down. Also, if you are trying to get a toothbrush into their mouth, which they are already resisting, they will pull back from the toothbrush, causing them to lie down further. If a client is unable to sit upright, then position your client lying down with their head in the neutral position. Prop pillows behind the client to prevent them from rolling onto their backs. Tilt their head forward to ease their dental care. In cases where the client can spit out secretions, always encourage them to do so. Working directly in front of a mirror is a good idea because you can see what you're doing and your client can see what's happening. It will comfort them to watch the process. Sit beside them, placing your non-dominant hand on their shoulders at the base of their neck. This is the hand that you don't write with. To ensure proper hygiene, it is very important to wear gloves when brushing your client's teeth. Use your dominant hand to hold the toothbrush. If your client does not open their mouth when you ask them to, reach your non-dominant hand to the base of their neck, above their shoulders. Using your non-dominant hand, place your index finger on their chin. Apply gentle pressure with your index finger to assist them in opening their jaw. If your client pulls in their lower lip, use a washcloth to hold their lower lip and gently pull it away from the teeth. Some clients become restless and agitated during dental care. Remember, this is not because of you, it's because of their oral hypersensitivity. If you cannot steady a client by placing your hand on their shoulders, you should sit behind them. Sit your client between your legs so that your knees can stabilize their shoulders. Sit on a chair, making sure your knees are level with your client's shoulders. Some clients suffer from tonic biting, which is when a client cannot control their biting and will bite on anything that touches their teeth. This is a physical reaction. The jaw is strong and full of muscles, and if you try to pull a toothbrush out of the mouth of a tonic biter, they will only bite down harder. If they are biting from the back of their mouths, try to support their head by placing your hand at the back of their neck. Hold the toothbrush in your dominant hand with your thumb on top. The toothbrush should be resting in the web of your hand. Your knuckles should be resting on their chin. Don't try pulling the brush out of their mouth. Instead, lift the handle firmly towards the ceiling. Quickly release the pressure, and then you can move the toothbrush into the side of their cheek and slide it out of their mouth. If your client is biting from the front of their mouth, support their head by placing your hand at the back of their neck. Place your dominant hand under the toothbrush handle. Place your index finger and thumb on either side of the nostrils. With controlled pressure, move your fingers down and out towards the edges of their mouth. Their jaw should open, and you should be able to remove the toothbrush with your non-dominant hand. If this does not work, then place your thumb or index finger into their mouth at the center of the upper gums. Gently move your thumb or finger inside their mouth along their gum line. When you are behind the molars, press towards the opposite side of their mouth for about 5 seconds. After their jaw opens, remove the toothbrush quickly. Clients who suffer from oral hypersensitivity benefit greatly from having their gums massaged. The ongoing process reduces their oral hypersensitivity and over time will make their dental care easier. It will also help alleviate their drooling. Massage their gums before you brush their teeth every day. Over time, they will become less sensitive to having their gums massaged and their teeth cleaned. The best way to massage your client's gums is to stand or sit beside your client. Wearing gloves, place your non-dominant hand at the base of their neck and above their shoulders. Using your dominant hand, rest your thumb and middle finger along their jawline. Keeping your thumb and middle finger in position, place your index finger in the center of the upper gum, right above their two front teeth. Use a gentle and steady pressure on the gums and move your fingers back towards the molars at the back of their mouth. If they are missing teeth, massage until the point where the bottom and top jaw connect. At the back of their mouth, behind the molars, apply gentle pressure toward the opposite side of their mouth. Bring your index finger out of their mouth as you apply gentle pressure to the lower gum line. Use your thumb on the other side of their mouth. Keeping your middle finger in place, position your thumb front and center of the top jaw. Follow the line of the top of the gums all the way to the molars at the back of their mouth. All the time, using a gentle and steady pressure on their gums. After you have reached the molars at the back of their mouth, follow the top of the gum line until you reach the two front teeth. Massage all the gums 3 times in a row. After you have watched this video a few times, you should feel comfortable about incorporating these techniques into your dental care routine. Over time, your clients will be more open to receiving dental care, and in turn, it will become easier for you to treat them. For more information, visit our website, ggrc.org.